Palliative care does not hasten death, and that's according to the World Health definition. We're not making that up from our own creative minds. That's standard, and it's standard in Canada also. And right now in British Columbia, the government has forced us to be providing euthanasia, and we said, no, that's not what palliative care is. And it's not according to our private society's constitution. And so the government just said, well, then what we're going to do is we're going to pull your funding because you won't provide euthanasia. It costs $400 to euthanize someone. So that is the cost of your life.
Under the John Horgan government, the Delta Hospice Society has had to battle giants in a fight to continue to operate as a palliative care hospice that offers a euthanasia-free environment for those who want a true palliative care end-of-life experience. And it looks like that battle has ended with the bureaucrat bullies on top, for now anyways. Drea, Humphrey here with Rebel News, and if you haven't already caught my first report on the legal battle and attacks that the Delta Hospice Society has had to endure in order to keep up with a 10-bed hospice free of medical assistance in dying, MAID, while still offering a safe transfer service for any resident who decides they would like to have that service. If you haven't seen that, you can catch that at rebelnews.com. But for now, I'm ashamed to say that when the government realized that snatching away $1.5 million of the Delta Hospice Society's funding, that wasn't enough to make the society to conform to their intolerant belief that every single non-religious palliative care facility must offer MAID, Fraser Health Authority ended up squashing their opposition altogether. The Delta Hospice Society board members have had their rights stripped away. They're in the process of being evicted by Fraser Health Authority, and I'm told that they have been left with no choice but to lay off their clinical staff in the middle of a declared pandemic. And for what? Upholding their society's constitution, which includes providing compassionate care and support for persons in their last stages of living, in an environment where they don't have to be offered assistance in death or overhear others partaking in that either. Is that really worth smothering the voice of this hospice? Well, this palliative care hospice may be dismantled, but the society itself isn't. I sat down to interview the president and vice president of the society, Angelina Ireland and Danielle Martel, so that you can hear what's been going on firsthand in this totalitarian takeover. And then I interviewed Dr. Margaret Caudle, who has been a palliative care physician for over 30 years. I want you to hear her opinion as well.
We were forced to give our staff notice that we will no longer be their employer as of February 24th, 2021. The Fraser Health Authority has canceled our service agreement, and in doing so, they will also cancel our lease, which means in effect they will evict us from our own hospice, and we will have no further role in the care that we have cultivated and procured over the last 10 years in that hospice. We fundraised about $9 million to build those buildings to provide palliative care to our community. We are a palliative care society, which means we do not offer euthanasia. Fraser Health Authority has forced our hand, and as a palliative care society, and according to our constitution, we cannot offer MAID. We are not fighting that about MAID, but we say that you can have MAID right next door at the hospital, but we're a palliative care facility and we do not offer it. So that's the situation now. We are very, very concerned because this means that there will be no palliative care services in Delta. I'm not sure exactly what they'll do, some kind of end-of-life service of some sort. We don't know. But, our role there is coming to an end. We are a palliative care society. We will continue to be. We will just move back to what we did before we had that building, and that was go directly into our community. So we have not forsaken our palliative care services. We will continue them. We now plan to go to the federal government and ask them to make an amendment to Bill C-7. We are asking the Senate to make an amendment for safe spaces for all Canadians, meaning that places like our hospice and other palliative care facilities should have the option to not offer euthanasia. So we are asking the senators to provide safe spaces and hospice sanctuary. And we ask that people join us in that quest to go to savedeltahospice.com and become a member, because it is only as a member that we can stand as a lobby and lobby for hospice sanctuary. And we also ask our members to go directly to the Fraser Health Authority and tell them that they are taxpayers, that 95% of Canadians want to die a natural death. They want palliative care services, that due to the fact that they pay for these services, they should not be disenfranchised. That as Canadians, they have the right to have the kind of service that they require. They have the right to choice at the end of their lives. And that the government should not force people to be having to live among other people who are being killed. We have stood on that premise to be able to protect people so that they would have a safe space with us at the hospice. So we ask that people now join us so that we can become a proper national lobby for safe spaces across this country, for the Delta Hospice to become a hospice sanctuary. And we think that if we have the backing of people and supporters, we might be able to turn this around.
This is quite an atrocity for Canadians today. It's just been a real grief what's going on here. We have no freedom of conscience in this situation. We haven't been allowed the freedom to have a no-kill place for human beings. And for people who want the choice to be in a place that is free from killing, they have no freedom for that in British Columbia right now. And for people that want palliative care services, palliative care does not hasten death. And that's according to the World Health definition. We're not making that up from our own creative minds. That's standard. And it's standard in Canada also. And right now in British Columbia, the government has forced us to be providing euthanasia. And we said, no, that's not what palliative care is. And it's not according to our private society's constitution. And so the government just said, well, then what we're going to do is we're going to pull your funding because you won't provide euthanasia. And we said, well, we can't do that. So right now, the Fraser Health actually forced us to lay off all of our staff. They, in fact, made no way to even transition to a place where the staff could be brought into end-of-life care even. That's what Fraser Health is doing right now. They're actually changing from palliative care into end-of-life care. And British Columbians need to be very concerned about that because they are no longer moving towards a palliative care model in British Columbia. They're moving towards an end-of-life care, and it's a fundamentally different medical practice. Palliative care is going by the wayside, and we won't have that practice anymore because they're starting to call it hospice care, and people need to be aware of the change in terminology because hospice care is something different than palliative care, and hospice care includes different medical procedures. They are providing euthanasia through hospice care. It costs $400 to euthanize someone, so that is the cost of your life. With palliative care, your cost of actually caring for you in your final days is very expensive. And so the quality of care for you, it may take you 2 or 3 weeks to pass. It may take you 2 or 3 months to pass. And so the cost of having you in a hospice bed is actually quite costly, whereas to have you euthanized is quite cheap. And no longer will Canadians have access to the high quality of palliative care, which is fundamentally different. You need to be very aware of this fundamental difference. Palliative care is ceasing to exist in British Columbia, and we need to be very aware and very grieved by this fundamental transition.
In terms of a facility that is not faith-based, the Delta Hospice within the Fraser Health region is the last bastion of a place where people who want nothing whatsoever to do with MAID or euthanasia or don't want to even be around it when it's happening, it's the last place that they would have to go within the Fraser Health, within the region.
So is there a concern with not having any palliative care place that isn't a faith-based organization that just strictly has palliative care and doesn't offer MAID?
I think it's a wonderful thing that we should have those facilities, even if it's only from a democratic standpoint. 95% of the people, even the folks who are in favor of euthanasia or think it's a good idea, 95% of people, they agree that 95% of patients are never going to want to have this. So the idea that somehow this has to be in every single place is just not even democratic. And people who are proposing this say, well, we need to have access to this for every single person who might want it. Well, that doesn't happen for other things. Like I mentioned before, it doesn't happen for intensive care. If you no longer want intensive care or need intensive care, you are moved to a different part of the hospital. If you no longer want renal dialysis, for example, you don't stay on the renal floor if you decide that that's what you're going to do, is you're going to stop dialysis. So it's very similar to that. And there isn't an access problem at Delta Hospice. That's the thing that's so mind-boggling about this. It's across the street from the Delta Hospital, which provides MAID if people want it, and actually to be moved from the Irene Thomas Hospice to the Delta Hospital would be less distance than to go from one side of the Surrey Memorial Hospital to the other. So this idea that it has to do with access is just, it's a red herring. It's not about access. And for people who want to be able to go to a place where they are not hearing about other people who are receiving MAID, they're not worried that they're going to maybe in a moment of weakness even ask for it themselves and be given it themselves. They deserve to have a place. They're taxpayers too. It's their tax dollars, their equity that the private citizens of the area put into the Irene Thomas Hospice. That's what's at stake here. And the government is basically appropriating this facility. And, you know, it seems so silly that a little 10-bed hospice out of all the beds in Fraser Health, that they can't just allow it to follow its own constitution. If they were to start offering MAID, they actually would be going against the Societies Act of British Columbia to be providing it, and going against the principles of palliative care, and going against what the majority of people are going to want at the end of their lives. It seems just foolish to me, and it seems very much like they're being bullied, especially when we see that the previous legislature that was just in, and the Speaker of the House, Darryl Plecas, did a white paper about this, and he looked at what to do in Fraser Health, and what he suggested seemed incredibly reasonable, that if you are a hospice society and more than half your funding is privately raised, then you get to decide whether or not, there's no prohibition for offering it, but you get to decide based on what your society agrees whether or not to offer MAID. So that seemed like a reasonable thing. The Delta Hospice Society offered to give back $750,000 to the government to raise that money privately to maintain the sanctuary for people who would like to go to a place where euthanasia / MAID was not offered. And the government turned them down flat. Why would you do that? It doesn't make any sense to me.
Palliative care is a 50-year medical discipline. We consider it to be a national treasure of Canada because we have had so much to do with the development of this discipline. Now, palliative care treats the whole person, the pain symptoms, the other symptoms that a person would have. It talks about the psychological, social, emotional, and spiritual needs of a person going through a life-threatening illness or even in their last days or months of living. So this is why we treat not just the person's pain, but everything that's happening to that person in their last days. And also a very important component is their family. So the person and their family come to our hospice and are treated. We have all kinds of services for not only the patient, but also for their family. Now, when you just go to a critical care bed or some kind of end-of-life bed, you are not given the full requisite of care that you are given in a palliative care facility. Our doctors are trained specially. Our nurses have to do an extra year of study to become a palliative care nurse. So it's a highly specialized field. Now what's happening in the rush towards MAID is highly, trained professionals are becoming party planners, right? They're being asked to help develop parties, plan parties for people who are going to have MAID. That is not what palliative care is about. Palliative care is patient-centered and family-centered. And that's what we need to hang on to. That's what we need to fight for.
Is your goal to stop MAID from being offered to other Canadians who want it?
Thank you for asking that. That's actually a really good question. No, our goal actually has never been to stop Canadians from having it who want access to it. In fact, the Delta Hospice Society respects patient choice. For our current patients who are in our hospice, if they decide that they want MAID, we will transfer them over to the Delta Hospice or the Delta Hospital. Our hospital is about a 1-minute drive or even a 2-minute walk from our hospice. And so we have nurses who are experts in transferring people. And so we transfer them over to the hospital to respect our patients' choices. We recognize that it is a law in Canada that people are allowed to access MAID. We are a palliative care society, however, and palliative care does not hasten death. And so it's just not one of the tools in our toolkit that we do here at our hospice. And so we have never offered it, but we do allow people to do what the law requires and to go and access it somewhere else.
What would it mean for hospices that only offer palliative care and then get pushed into offering MAID as well? What would it mean if Bill C-7 passes?
Bill C-7 in its current state is particularly dangerous to hospices and palliative care facilities. That is because all of our patients would be considered having a foreseeable death. And if you have a foreseeable death with the new legislation, you can ask for MAID one day and be given it that same day. So there's no time period. And what actually happens is your worst day becomes your last day. So in our situation, if a person came into our hospice and they were not in a good state, they're, psychologically and physically they were feeling unwell, we need some time to get their symptoms under control and to get them psychologically feeling better and having more hope again. But with C7, that person could ask for MAID and be given MAID that day. So basically they just check in to check out, right? It will just become a revolving door of death. This needs to be stopped. That alone is a reason why we need hospice sanctuary. So we can opt to protect our patients like we have been trying to do here at the Delta Hospice for 12 months after we've been told that we have to provide MAID, and we've resisted. So, these are the issues that are facing Canadians that they need to understand, that we need to provide safe spaces, we need to provide sanctuary for the dying, and this is a humanitarian choice, one that the government needs to listen to.
Have you come across anything like this in your career?
Well, more and more now with the change in the law in 2016, we are seeing more of this idea of hastening death, euthanasia, MAID, whatever it's called in different jurisdictions in the world. We're seeing that more and more, and it's being pushed into palliative care. But palliative care at its core is the definition of it by the World Health Organization is that we neither hasten nor postpone natural death. So technically, this really does not fit into the definition of palliative care. We have seen pushes in the past from some groups that would like to see it be part of palliative care. And of course, people who want to save money or think that this is a good idea philosophically think that, oh, it just belongs at end of life. But it doesn't any more than other things belong in intensive care that are not intensive care, et cetera. So many of us who have been doing this for a long time are very distressed and grieved by the fact that this is being pushed into palliative care and being considered part of palliative care, at least by some people. I'd just like to say to anyone who's listening, please follow this issue. This is not only about this particular issue, but if the government can overreach in this area, this really important area that's life and death, then there's really no limit to where else they can overreach. And we are the government. They work for us. So we need to make our voices heard to say this is not acceptable to us. And thank you for getting involved.
You guys are being evicted, forced to lay off people in the middle of a pandemic. And where are you guys going from here?
Yeah, before we had that building, this society has been in existence for 20 years. Well, 30 years in total, but 20 years before we actually had a facility. So if the government pushes us out, we do not cease to become a palliative care society. In fact, we ask people to join our society and make this society nationwide, so that we can help other societies that are in our position, teach them what they need to do to protect themselves and what will happen if the government closes them too. We will go back directly to the community. That's what we used to do. We will go directly into people's homes. We were palliative care home care. That's what we will do, because it may end up that your home is your safe place. So we will go and we will help you, bring you palliative care services there. And it's important that people understand that this is not the end for us. In fact, this is a new beginning, and that people need to join us at savedeltahospice.com, buy a membership to the society, help us to lobby against the Fraser Health Authority, help us to spread the word to other Canadians that we are the first, but we will not be the last. They are coming for you too. Together, we can face it and we can fight it.
Crazy, hey? What exactly does this mean for other private clinics that don't bend to something as controversial as assisting someone in their death, but the government says they want them to do so anyways? Will they be wiped out as well? I reached out to the Fraser Health Authority for their side of the story, and I haven't heard back yet, but if I do hear back in a timely fashion, you can check out the update on the written article to this at rebelnews.com. If you appreciated this report at all, please head to rebelnewsplus.com. You can sign up for all of our content there, but most importantly, you can keep in touch with us even if Big Tech decides to limit freedom of press and removes us from the platform you're watching us on now. We appreciate your support.